Good evening. Heart disease is still the #1 killer of men and women, so until that fact is gone, I'll continue to do these IG Lives. I'm Dr. Twyman, board-certified cardiologist who's been helping people reduce the risk of heart attacks and strokes since I became a physician over 20 years ago. I've had my own practice for the past 6 years, Apollo Cardiology in St. Louis, Missouri, and I've been doing these IG Lives since at least 2020 to try to help you guys understand what really drives cardiovascular risk and what you can do to minimize the events rates that you may have. Strokes and heart attacks and stents being the main ones you want to avoid. So there's a few questions tonight that we'll answer. A little bit of housekeeping. So I do have a school community where I share a lot more information than I'm able to do on Instagram. So I just uploaded a video about the Connect QT Pulse and how I use it for myself and how to interpret all the findings on this. I went over somebody's Clearly results and their advanced lipid profile. And I will, in the near future, be talking about a new nitric oxide supplement that is out. And then what kind of gear that I use to screen my arteries at home and what I recommend my patients to screen at home. I also do longer Ask Me Anythings on there. Those would generally be the first Fridays of the month. If you're ever wanting to ask me more questions about your own case, then you can ask here on Instagram. The school community is where to do that. So it's drtwyman.com/school, and school is spelled SKOOL. If you just go to school.com, search for Dr. Twyman, you'll find my group as well. The other housekeeping tip tonight is the Canyon Ranch Retreat is October the 29th October the 31st or November 2nd. I have sent out a group message and Telegram if you're on there about what I plan to do on that trip. I shared some screenshots of the app where you can book the events that I'll be attending. So if you didn't get the Telegram message, check it. If you're not on Telegram yet and you've signed up for the event with me, please message me here and let me know your email address, and I'll resend you the link to join Telegram. So with that housekeeping out of the way, we'll jump into the couple questions we have tonight. So the first question is, should we worry about saturated fat? The short answer is it always depends. So saturated fat in some individuals will have a significant effect on their lipoproteins. It will raise their LDL cholesterol on their traditional panel. It'll raise their ApoB and LDL particles on their NMR and advanced lipid profiles. Does not happen to everybody, potentially 20% of the population, but tends to happen more in patients with an ApoE4 allele. So that's a genetic test. If you have an ApoE4 allele, you often will see this. Some patients, if you do the Boston Heart Lab diagnostic panel, which looks at the cholesterol balance test and the fatty acid balance test, you can sort of predict who's more likely to have issues with saturated fat. In those individuals, the medication ezetimibe also works well for them. If you want to know all the genetics that may affect your body's ability to metabolize saturated fat and how it may affect lipoproteins, then the GB Health Insight Panel is what you should do. I do that routinely for patients who are, quote, lean mass hyperresponders. Those patients when they eat high-fat diets because they're selectively low carb. Some of those individuals, lipids significantly increase. They look like they have familial hyperlipidemia with total cholesterols over 300, LDL cholesterols over 190 milligrams a deciliter. And it's the case where if they change their diet, their lipids go back to normal. So it's probably in part that it has an effect on the liver's production of more particles. Also, it downregulates the LDL receptor. The LDL receptor sits on the outside of the liver and plucks the cholesterol particles out of the circulation. So you make more cholesterol particles and you don't get them out of the bloodstream as fast in some individuals. So that's why some people should be concerned, but not all. All right, an administrative question. So how do you schedule an office visit with us in St. Louis? So my practice, Apollo Cardiology, is located conveniently about 10 minutes from the airport in St. Louis. So we have a great majority of our patients work with us remotely after their first visit with us in St. Louis. You don't have to come to every appointment live, but the first one has to be in St. Louis, so we get to meet you, and you can do all the cardiovascular testing in our office where we look at vascular health markers. We look at carotid endothelial thickness scans. We look at nitric oxide testing, and we can send off all the advanced blood work and genetics. If you're interested in working with us, my website, drtwyman.com, as an application. A member of my team will then contact you and set up a call to discuss the logistics of how to work with us, how we can get access with you to your old medical records or labs that you would like us to review before the visit, any other imaging you may have had, and then you'll get a very comprehensive questionnaire about your lifestyle so that we can understand how we can best help you. And then the last pre-submitted question. So what are the best supplement regimen for a 45-year-old with blood pressure of 145/90? So that is stage 2 hypertension. So there are no best supplements initially. It's what is the root cause of why you have high blood pressure. High blood pressure is not a disease per se. It may have a code that is a billing code for hypertension, but there is a cause why you have elevated blood pressure. It's a response to something in the environment. Oxidative stress, inflammation, vascular immune dysfunction. Oftentimes it's nitric oxide deficiency. So if you do the root cause analysis, you find out why the blood pressure is elevated, and then you supplement what is deficient or remove the things that are causing the damage. Nitric oxide supplements may help in this individual. Magnesium may help, but you really want to figure out what's driving it and be more precise and precision driven. There's no one-size-fits-all supplement cocktail for blood pressure. All right, so that was the pre-submitted, so I'll wait for some comments and questions to pop up if you want, but maybe I'll just give you a quick summary of what I just went over with my group in the school community. So this is the Connect QT device. It measures your brachial blood pressure, so the blood pressure in your arm, but more importantly is the blood pressure that comes out of your heart and goes down your heart arteries and down your arteries into your kidneys and then up to your arteries in your brain. That is known as your central aortic blood pressure. This device can measure that. So this device takes the blood pressure, it records it, and then on the screen, you can then review your results. So it will give you the brachial pressure, central pressure. It will give you your augmentation index, which is a marker of how stiff the arteries are. It will give you a marker called SEVR, the subendocardial variability or viability ratio. That number should be over 100%. If the number's under that, that could be a marker that you don't have enough blood flow to your heart tissue. Could be a blockage in the arteries, or you have very stiff, thick heart from long-standing high blood pressure. So the Connect QT device is the best home device at measuring your blood pressure. There's other monitors that I recommend, the Omron Evolve being one of them, and I'm putting together a list of the best home screening devices, and that will be in my school community. So if you're interested, that's drtwyman.com/school. But I will still be sharing a lot of my wisdom and tips here on Instagram every Monday night. So what are my thoughts on weightlifting and people with aortic root aneurysm? It depends on how large the aneurysm is, depends on what kind of activities may or may not be safe for you. If you're lifting heavy weights and you're increasing the intrathoracic pressure because you're holding your breath with those, it may increase the shear stress in the aorta and increase the risk of dissection, tearing the lining of the arteries, which can be a fatal event. So it depends on how big the aorta is, depends if it's genetic. Do you have a KIF6 mutation? Do you have a history of Marfan's in the family or Louis Dietz syndrome? Those people can't do any type of weightlifting. Depends also on the rate of progression. So if it's been stable for many years, probably less of a concern, but if it's increasing a couple millimeters per year, then you got to be very careful on not increasing the shear stress and the intrathoracic pressure. And you generally want to keep your blood pressure significantly under 120/80, generally with an angiotensin receptor blocker and a beta blocker. Use enough beta blocker to keep a heart rate generally 55 to 65. All right, so somebody's asking me about my bathtub analogy, so they must have heard me say it on a podcast or in the office at some point. Now, this is my own analogy. It's a good one, not perfect, but sometimes helps people understand when they're taking either supplements or medications for their lipids, which agents are likely to work best. If you have a Boston Heart Diagnostic Panel and you have the cholesterol balance test, the best way to look at this test is think of cholesterol as water going into a bathtub. You're trying to prevent that water from overflowing the bathtub. Think of water overflowing the bathtub as plaques forming in your arteries. So how can you prevent the water from overflowing? Well, the water's coming in, you could go in there and turn the faucet off or dial the faucet back. That would be like using a statin or Nexletol to dial back how much cholesterol is being produced. Supplements, red yeast, rice, or bergamot. They don't work as well, but they can work on those cholesterol production markers. Less water goes in the bathtub. Some people have an issue with the drain. The cholesterol receptors, the allele receptors, aren't sufficient in volume to pull out the cholesterol from the circulation. So you basically have a blockage in the drain. So supplements, berberine might have an effect, but it's not very strong. So often if people have an issue there, that's what the PCSK9 inhibitors help with. Repatha, Praluent, ilasclerin. They block the enzymes that degrade the allele receptors. The allele receptors stay out, clearing the cholesterol particles from circulation. It's like opening up the drain, the water flows out. Some people have an issue where the sewer is blocked. If the sewer is blocked, the way to unblock it is ezetimibe. Ezetimibe prevents the cholesterol from reabsorbing into the bathtub. It doesn't backflow into the liver. So if you use ezetimibe, the water flows out to the street. So if you lose the cholesterol balance test, you can figure out is it an issue that you can dial the faucet back with, or do you need to open up the drain, or make sure that once the water's in the drain, it flows out to the street. So that's the bathtub analogy. All right, so I don't see any other questions coming in tonight, so maybe short and sweet. So every Monday, 6 p.m. Central Time, I'm on here answering your questions. Generally between 7 and 8 Central Time, I'll put up a story where I'll put the post where you can drop the questions. And I can't answer direct one-on-one medical questions, but these questions where it's in generalities and just, can you summarize something? Happy to do that part. If you potentially want more information, my school community is where I'm dropping that knowledge, longer form videos, ask me any things that are longer. That's where that's going to be, demos of different products. And then if you really want the hand-holding, the one-on-one, done-for-you type of service, that's what I do at Apollo Cardiology. So drtwyman.com has an application if you're interested in that. We still have some availability this year, but we're booking out many months into the future. Pretty soon we're going to close down the practice of new patients this year, and you're going to be booking out into next year. So hope you guys have a great rest of the evening, and I'll see you guys next week.